Another place where you might find yourself really engaging and working with clinicians is like that example I showed you earlier from the Royal Adelaide Hospital, where they turn their attention towards research, not just clinical practice. And often that research that clinicians are interested in, of course, is a systematic review. Not necessarily of course, but certainly when we're talking in the field of evidence-based healthcare, it's well aligned. And they really do, and the best recommendations are, we certainly recommend when in the conduct of systematic reviews that we do, or when clinicians are working on systematic reviews, or anyone's working on a systematic review, that they really do work very closely with a librarian or an information scientist. There are skills, there are tricks, there's even some black magic involved, who knows, about how to make the most of those platforms and those tools and to find information efficiently and effectively. And it is incredibly important in a systematic review that that's conducted properly, but also that it's really well reported. There are international guidelines about how systematic review should be reported. An incredibly important part of that reporting is reporting of the search strategy. Any systematic review, just like an original primary research undertaking, should be reproducible. And the only way a systematic review can be reproducible, besides all the tools we use to appraise and the statistical tricks we might use to do a meta-analysis or statistical combination, we must be able to reproduce the search. And a well-performed and comprehensive search is essential in a review, and that it be reported properly in a review. Not just the search terms and filters used, but where the appropriate places to search, why they've been appropriate places to search, and also the dates that have been searched, the index terms that have been used. Any person who's looking at the quality of a systematic review will turn to that search strategy to then assess. That will be a key factor in determining whether it actually fulfills the criteria for what is internationally recognised as a systematic review. And librarians really play, and information scientists play, a key role in helping researchers and clinician researchers get that right. Another place is, we spoke about champions earlier, I spoke about champions earlier. They're so important, as I just mentioned, in developing successful and reporting accurately repeatable search strategies. But also in some other parts, certainly within the systematic review process and the broader field of evidence-based healthcare, as I said, for evidence-based practitioners, in terms of being able to, for example, formulate and ask a clinical question. That's a skill that doesn't come naturally to all sorts of people, to everyone. And many clinicians, for example, might not have tried that before, and there's a unique trick to thinking and conceptualising things in a way so you can align the way you ask that question to the concepts that are then used to search. You, as librarians, you're brought up with that. It's kind of embedded in you. But for many clinicians, that might be trying to teach an old dog a new trick, and they really do need to be worked through that process. And of course, they always will need help in identifying appropriate sources for evidence, and to keep policy and procedure manuals up to date. So there's a broad range of areas where there's real synergy and potential for the librarian and the library. I'm not talking about the library where, you know, we used to think of a library with books on the shelf, but the resources that you all have available, and that you're really the conduit for those resources coming in and being available for that institution. For example, in this role as champion, recently at the State University of New York Upstate, the medical library has actually created a new role of clinical outreach librarian to really facilitate and to really clinicians moving into that field of research and into systematic reviewing, and how to best manage and find the resources and evidence that they need to facilitate the research that they're doing. And now I'll hand back over to Anne.
We talked about the librarians and their role in working with systematic reviewers. I also would like to mention a recent addition for us, the Ovid Pico Resource Center. And no, this is not a librarian behind the page, but it does help those nurses, particularly I think, who went through the RN program, went through that 2-year program because it's such a hands-on practical approach or program, they didn't get that background in doing research. And when they typically go back for the RN to BSN program and then maybe go on for the advanced degrees, they are the ones who just really need to develop their research skills to get more comfortable doing research. And a page like this is great because it steps them through forming that PICO question. It actually asks the question and you fill in the blanks, and then it does the search for you and returns fairly good results. Is it in place of a librarian? No. But it's just a nice way it's very approachable, easy to use. And one of the things I like about this is that it also includes PICO videos and PICO cards. So there's a little bit more going on there than just stepping them through how to form their PICO question.